Now I want you to look at this photo with me. This is a real patient. Take a second. Look at her eyes. Which one looks more natural to you? One is fine, the other is not. Okay, so let's just start with this. Back in the 1990s, magazines started running a trick on their readers. They take a photo of a famous celebrity, someone that everybody already agreed was beautiful, and then they'd mirror one side of the face to the other. So the left half of the face became identical to the right half. Perfect symmetry. The results? Kind of unsettling. The faces just looked wrong. The kind of wrong that you just can't really say why, but you know it the second you see it. And these were faces we had already decided were the most attractive faces in the world. What that trick proved, in the crudest way possible, is something I want you to sit with for a second. Faces are not symmetrical. Not yours, not mine, not the people on magazine covers. The two halves of your face have always been a little different from each other. And so the real question is not whether your face is symmetrical. It isn't. The real question is why you're suddenly noticing. And the answer, almost always, is cell phones. When you look at a selfie, you're often seeing your face flipped or unflipped for the first time. And the asymmetry that was always there suddenly looks brand new because you're kind of thrown off by it. Patients walk into my office and they are certain that something has changed when really it's just their cell phone showing them what was always there. The takeaway from this, a little asymmetry is normal. Everyone has it. It's actually what makes us all beautiful. But if there's enough of it to catch your eye in every single photo, there's usually a specific thing driving it. And in my practice, it almost always comes down to one of these things. So number one, the most common reason one eye genuinely looks smaller than the other is a problem with the muscle that helps open your upper eyelid. The medical term for this is called ptosis, silent P. Think of like a small cable behind the eyelid skin whose only job is to just pull the lid up when your brain tells the eye to open. When that cable is working the way it should, the lid sits in the right place and you look alert and awake without having to do this all the time. Now, when the cable stretches out or loses some of its strength over time, that eyelid sits lower than it should, and the eye underneath it just looks smaller and sleepier, for lack of a better word. Some of my patients walk in and they say they have a lazy eye, which isn't the exact term for it, but it kind of makes sense when you think about it. It usually happens on one side first, which is why patients notice asymmetry. Now here's how to check yourself. Do this for me. Sit in front of a mirror and look straight ahead, but really let your forehead relax. No effort, none of this, no holding the eyes wide open. Just close your eyes for a sec. Let that relax, slowly open them, and look in the mirror at the upper edge of each eye, right where the eyelashes come out. Normally, that edge sits just above the colored part of the eye. So a small sliver of color, whether it's blue, green, brown, that small sliver of color should show a little bit above the pupil, which is the black dot in the center of the eye. If on one side, that edge is getting lower, covering more of the colored part, or even crossing into the pupil itself, that, my friends, is ptosis. The trick here is the relaxed face. Most patients with ptosis are unconsciously doing extra work with their forehead to hold the eye open or their chin up, and they don't really realize it when they're doing it. So the takeaway from this, if you fully relax your face and one eye droops noticeably more than the other, you might have some ptosis. That's cause number one. But here's the thing. Your muscle could be working perfectly, meaning your eyelashes are right where they need to be relative to the center of the eye. But you could still have a problem where one eye looks smaller than the other, because the eyelid muscle is only one part of how alert your face looks. Okay, so if the muscle isn't the problem, the next place I look is everything around the eyelashes, the frame of the eyelids. Above the eyelid is the eyebrow, which is basically the frame around the eye. When one eyebrow sits lower than the other, even by a millimeter or two, it crowds everything beneath it, and the eye on that side looks smaller and heavier. So here's how to check. Go back to your mirror, totally relaxed, and compare the two eyebrows. Are they at the same height? Does the arch of the eyebrow have the same shape, or is one just a little blunted and a little bit lower? If one brow is genuinely lower than the other, or if one upper eyelid looks like it just has more folded skin than the other, then that's your answer. This is the cause that gets missed the most often. But I want to pause here for a second and tell you about something really important. If you have total paralysis on one side, meaning half of your face is drooping down, that could be something really serious, and that is going to paralyze, in most cases, that forehead muscle. So you won't have any wrinkles on one side, but you will in the other. If you have this, you need to call your doctor right away or go to the ER, because this could be the sign of something called facial palsy. Now, most of the time, facial palsy is caused by a virus, and you can take antivirals or even some steroids, and it may or may not get better. But rarely, facial palsy could be the sign of something going on in your brain. And a lot of times, you're going to want to get an MRI to make sure there's nothing going on in there. That is very important. If you take away one thing from this video, I want you to understand that big time asymmetry between the face, where one side doesn't move and the other side moves just fine, you got to go get checked. If you're like most people watching this, you're already trying to figure out which one you have. So hold off on that for just one more minute, because there's a third cause. And this one might mean that you need radiation, neck surgery, or even get hospitalized or lose your vision. Okay, now I want you to look at that first photo again, because the patient I opened this video with doesn't have a problem with her eyelid muscle. She doesn't have brow asymmetry. She doesn't really have extra skin. The eye that looks smaller, that's actually one that's totally fine. The eye that looks bigger is the one with the problem. This condition is called thyroid eye disease, and it's one of those diagnoses that just has a wide range of issues beyond just the eyelid. So, quick sidebar on anatomy. Your eyeball sits in a deep cone of bone called the orbit, or the eye socket. The eye is surrounded by fat and muscle and connective tissue that just kind of holds everything in position. If you get thyroid eye disease, that's an autoimmune condition that causes, in many cases, the tissue behind the eye to swell up, which can do two things. Sometimes it pushes the eyeball forward. Medical term for this is ptosis, again, silent P in the middle. But you can just call it bulging. The affected eye juts out farther, and suddenly the eye on that side looks much bigger, much more like somebody staring, because more of the white of the eye is visible. And here's the key thing. Usually the first sign of a thyroid problem going on in your neck is that on one side, your upper eyelid sits higher than it should. This is called eyelid retraction. The eye isn't necessarily bulging forward. The eyelid is just pulled up too high, like a window shade pulled too open. And it can almost make it look like somebody is permanently staring. Some patients walk in convinced they have a droopy eyelid on the smaller looking side, when in fact that side's fine, but really they have a bulging eye or eyelid retraction on the bigger looking side. That's what happened with our patient. They've been looking at the wrong side the whole time. Now, if you have this means you need to see your primary care doctor and get some blood work. You might have to see an endocrinologist and potentially treat the underlying autoimmune problem before any conversation should occur about eyelid surgery. Once that disease is stable, then we can talk about what to do surgically, but not before. Here's when you maybe need to think about thyroid eye disease. If the asymmetry came on sort of quickly in kind of like months rather than slowly over years and years, or if you have double vision, even occasionally, or if one eye just feels different from the other, like there's more pressure behind it or more dryness, or just a sense that all of a sudden you don't look like yourself, something's off. Even worse, if you start having rapid heart palpitations, night sweats, unplanned or unexplained weight loss, that's the kind of stuff that could put you in the hospital. Any of those things, don't go shopping for eyelid surgery. Go see your doctor, get some blood work first. Okay, I told you at the start of this video, there was one more cause I wanted you to know about. This is not about cosmetics. This one is about your life. There's a condition called Horner's syndrome. It was named after a doctor. It's not a disease in and of itself. Horner's syndrome is a sign of something else going on. And that something else that could be going on could be life-threatening. So you have to understand this. There's a nerve pathway that runs from your brain, through your neck, through your upper chest, and then back up to your eye. Sounds weird, I know. But when something damages that nerve pathway anywhere along its course, you get a specific combination of findings on that side. The upper eyelid droops, where those lashes come down, just a little bit. The pupil, that black dot that we talked about earlier, is a little bit smaller on one side than the other. So the same side where you get a little bit of a droop you also get a little bit of a smaller black dot. Sometimes even that affected side of the face stops sweating. This can look like a run-of-the-mill droopy eyelid, but it's something called Horner's syndrome. And Horner's syndrome is almost always never the actual problem. Horner's syndrome is the alarm bell going off. The thing that could be causing it could be a stroke. It could be a cancer pressing on the nerve somewhere in the neck or the chest. It could be a tear in the wall of a major blood vessel running up to your brain, the carotid artery, and that can cause a stroke if it's not caught. Here's what I need you to remember. If you suddenly notice a droopy eyelid on one side and the pupil on that side looks smaller than the other, especially if this happened over a couple hours, few days, this is something you need to get checked out right away. Sometimes this is associated with back pain, neck pain, a headache, or a recent trip to the chiropractor. Do not schedule a consultation for an eyelid surgery. Do not wait to see if this goes away. Go to an emergency room. Call your doctor. Most of the time in my practice, the asymmetry that people notice is something that I can help with in my office on a normal schedule when we had time to carefully look at everything. But once in a while it's this, and that once in a while matters a lot. I'd rather you watch this video. Remember that combination of things: slight droop, small pupil, neck pain, and I'd rather you waste a trip going to the ER over something harmless than miss this the one time that it mattered. So here's where we land. The eye that looks smaller isn't always the problem. The problem might be the muscle or the frame around it, or where the eye is sitting in the eye socket if it's in the wrong position, or something much deeper than any of that. And the only way you know is to have someone actually qualified to look at it. If you found this useful, hit subscribe. There's more like it on my channel. If you've got a question about your own eyes, leave it in the comments. I do read them. Just know that for anything specific to your own anatomy, the only real answer is an exam in person. Thanks for watching.